populated rural county.
Yeah.
So walk us through how this happens, because you mentioned that, you'll see devolution depending on who sits at the top. And that was how it was before devolution made its entrance into the scene. But then devolution comes along, and then now you have county governments, you have county executive committee members, you have members of the county assembly, you have all of these people who are working for the development of a particular region. So how does it work? And we also know that because of the revenue allocation, that there's a certain amount of money that comes to the county. So under your docket, you want to see, because there are many, there are roads, there's infrastructure, there's water, there's medical services, all of these things. So you want to bring water into where? Matungu.
Matungu is where the governor comes from.
Let's go to Matungu. What happens? How does it work? Because now if you say, if Peninah says, I brought water to Matungu, how exactly did this happen?
So let me walk you through how it works. At the county level, we have the county assembly and the county executive. The county executive is headed by the governor, His Excellency the governor. The county assembly is headed by the speaker of the county assembly. But the two must work in closer collaboration and consultation for development to work. Because for us, we'll give them our budget proposals based on what came out from the public participation on the ground. Then it's the county assembly to approve that budget. But also, we don't just budget anyhowly. We budget based on the resource envelope that we have. For instance, at Kakamega County, we are required to raise 2 billion from our own source revenue, and we get 15 billion from the exchequer. And then the governor, based on his priorities, his manifesto, and the annual development plan, he's able to cap to tell us now, this is your ceiling. For you, the CEC in water, your ceiling will be 800 million development. Roads, we are going to give you 1.5 billion development. Health, and so on, based on the priorities. And you realize most of the priorities are usually towards health, roads, and water. I mean, health, roads, and education. Water comes in third or fourth. And then the others, of course, lands and the other sectors. So once the county assembly approves the budget, we start the implementation. But it's a long journey. Before we arrive at the budget and approval of the budget, we have public participation forums in every constituency, and people are drawn from each ward. So the level of devolution does not just end at the county, it goes up to the ward, because the MCAs also know their priorities in the various wards. And for the case of Kakamega County, we even have ward-based projects in every ward. For instance, there is ward-based water projects, there's ward-based education where we do ECDs in every ward, there's ward-based in roads. So every ward also is allocated a budget for roads, a budget for water, a budget for education. So that is how far devolution has been able to go up to the lowest unit in the county, and which is the ward. Kakamega has got 60 wards, and we are able to do projects in all the 60 wards.
I mean, there has to be proper collaboration between national and county governments for devolution to really thrive, right?
Yes.
And here I wanted to look at your docket for water, because many would look at it in terms of, fine, I got water in my home. Yeah, we look like a city or a town. That is good. But if you go back to look at what that does, because when you talk about preventative medicine, water is a key subject, because then waterborne diseases and many other facets, sanitation is key, right? So that means the water docket must work with the health department for that to be a success. But you look at the overall general agreement that water is not only number one priority, but perhaps if we fix that, then the stress level in the health sector, which is also devolved, then is also addressed. Are we having this conversation from that level, or is CEC water, CEC health, CEC health? Yet one thing that brings you guys together is not being discussed.
And that is why we have a cabinet, and in that cabinet at the county level, we have the CEC water, the CEC health. And then, of course, we have interdepartmental meetings where the county secretary chairs, and we are able to discuss and agree on priorities as a team, but not just as one person. And for Kakamega, the governor is justified to put health ahead because, as I told you, the historical injustices. Kakamega County did not have even a referral hospital, but now it has been set up. Now, as the governor fights to make sure there is water available to prevent waterborne diseases, he must also balance the act to ensure that there is a newborn unit in Malava Sub-County Hospital where the premature babies can be they can be rescued. So as much as he would want to focus on water to prevent the waterborne diseases and other diseases, then he must also ensure that the current health system